According to a recent study, more than 50% of people with kidney disease are unaware of their condition, and that's a big problem. In today's video, we are going to reveal 7 protein-rich foods that can help you combat proteinuria and support kidney repair. But first, let me ask you a question. Do you know what proteinuria is and how it affects your kidneys? If you don't, you are not alone. Because proteinuria, or excess protein in the urine, is one of the main signs of kidney damage. It can also lead to serious complications, such as high blood pressure, swelling, and kidney failure. That's why it's important to eat a protein-rich diet, because protein can help reduce proteinuria and support kidney repair. But not all proteins are created equal. Some are better than others for your kidneys, and that's what you will learn in this video. You will discover 5 affordable and protein-rich foods that are kidney-friendly. You will also learn some tips and tricks on how to include them in your daily diet. These foods can make a huge difference in your kidney health, so like, share, and subscribe for more health guidance. Now, let's get started. Before we talk about these 5 protein-rich foods, let's take a quick look at what proteinuria is and why it matters. Proteinuria is a condition where you have too much protein in your urine. This can happen for various reasons, such as infection, inflammation, diabetes, high blood pressure, or kidney disease. Proteinuria is not only a sign of kidney damage, but also a cause of it. When you have proteinuria, your kidneys have to work harder to filter out the excess protein, which can lead to scarring, inflammation, and loss of function. Proteinuria can also cause other problems, such as swelling, fatigue, nausea, and poor appetite. That's why it's important to treat proteinuria as soon as possible, and one of the ways to do that is by eating a protein-rich diet. Number 1. Egg. Eggs are one of the best sources of protein for your kidneys because they contain all 9 essential amino acids that your body needs to build and repair tissues. Eggs are also rich in other nutrients, such as choline, biotin, selenium, and vitamin B12, which are good for your nervous system, metabolism, and immunity. But how many eggs can you eat per day if you have proteinuria? Well, the answer depends on your overall health and kidney function, but generally speaking, you can have 1 or 2 eggs per day, preferably boiled or poached, rather than fried or scrambled. You should also avoid adding salt, cheese, or bacon to your eggs, as these can increase your sodium and saturated fat intake, which are bad for your kidneys. Instead, you can add some herbs, spices, or vegetables to your eggs, such as parsley, turmeric, or spinach, to make them more flavorful and nutritious. Number 2. Protein-rich soy. The second protein-rich food that can help you combat proteinuria and support kidney repair is soy. It is a plant-based protein that is also high in fiber, antioxidants, and phytoestrogens, which are compounds that can help lower your cholesterol, blood pressure, and inflammation. Soy is also low in potassium and phosphorus, which are minerals that can build up in your blood and damage your kidneys if you have kidney disease. Its per-day dose depends on your personal preference and tolerance, but generally, one can have up to 25 grams of soy protein per day, which is equivalent to 1 cup of soy milk, half a cup of tofu, or a quarter cup of soy nuts. One should also choose organic and non-GMO soy products, as these are safer and healthier for you and the environment. One should also avoid processed soy products, such as soy sauce, soy burgers, or soy cheese, as these can contain additives, preservatives, and sodium, which are harmful for your kidneys. Number 3. Quinoa. Quinoa contains all 9 essential amino acids that your body needs for normal health. It is a gluten-free grain, which is low in sodium and potassium, which are good for your kidneys. But what is the recommended quantity for a patient of proteinuria? It depends on your calorie and carbohydrate needs, but normally you can have up to 1 cup of cooked quinoa per day, which is equivalent to about 40 grams of protein. You can use quinoa as a substitute for rice, pasta, or bread, or you can add it to your salads, soups, or casseroles. You can also cook quinoa with water, milk, or broth, and add some fruits, nuts, or seeds to make a delicious and nutritious breakfast or snack. Number 4. Dairy. Dairy products such as milk, yogurt, cheese, and cottage cheese are high in protein, calcium, and vitamin D, which are good for your bones, teeth, and muscles. Dairy products are also high in lactose, which is a type of sugar that can help lower your blood pressure and improve your blood flow. But how much dairy can you eat per day if you have proteinuria? The answer depends on your kidney function and phosphorus level. However, normally, you can have up to 1 cup of milk, yogurt, or cottage cheese per day, or up to 1 ounce of cheese per day, which is equivalent to about 30 grams of protein. You should also choose low-fat or fat-free dairy products, as these are lower in saturated fat and calories, which are bad for your heart and waistline. Also avoid flavored or sweetened dairy products, such as chocolate milk, ice cream, or yogurt with fruit, as these can contain added sugar, which can raise your blood glucose and damage your kidneys. Number 5. Whey protein. Whey protein is a byproduct of cheese making, and it is one of the most bioavailable and digestible forms of protein. They are rich in branched-chain amino acids, or BCAAs, which are essential for muscle growth and repair. Whey protein is also low in lactose, sodium, and potassium, which are good for your kidneys. The recommended quantity depends on your body's protein needs and tolerance, but generally speaking, you can have up to 20 grams of whey protein per day, which is equivalent to 1 scoop of whey protein powder. You can mix whey protein with water, milk, or juice, and drink it before or after your workout, or as a meal replacement or snack. You may also add whey protein to your smoothies, oatmeal, or baked goods to boost your protein intake. Furthermore, you can also choose whey protein isolate, which is the purest and highest quality form of whey protein, and avoid whey protein concentrate, which can contain more lactose, fat, and carbs, which are not good for your kidneys. Number 6. Ladyfinger. Ladyfinger, also known as okra, can be beneficial for managing proteinuria and improving kidney health due to its various properties. Okra contains a significant amount of soluble fiber, which can help lower cholesterol levels and reduce the risk of cardiovascular diseases, ultimately supporting heart health. Additionally, the soluble fiber in ladyfinger helps in stabilizing blood sugar levels, which is crucial for individuals with kidney issues, as high blood sugar can exacerbate kidney damage. Furthermore, ladyfinger is rich in antioxidants like vitamin C and polyphenols, which help reduce inflammation and oxidative stress in the kidneys, promoting their overall health. Including ladyfinger in your diet can thus contribute to managing proteinuria and supporting kidney function effectively. Number 7. Jicama. Jicama, also known as Mexican turnip or yam bean, is a root vegetable with a crisp texture and slightly sweet flavor. It is rich in dietary fiber, vitamins, and minerals, including vitamin C, potassium, and folate. A high fiber content of jicama can help regulate blood sugar levels and improve digestive health, which are important factors in managing kidney function and reducing proteinuria. Additionally, its antioxidant properties may contribute to kidney health by reducing inflammation and oxidative stress. Incorporating jicama into your diet can be a unique way to support kidney health and reduce proteinuria. Finally, incorporating these protein-rich foods into your diet can be a game changer for kidney health. From the versatile eggs to the plant-powered soy, nutrient-packed quinoa, wholesome dairy options, and the muscle-friendly whey protein, each food brings unique benefits for combating proteinuria and supporting kidney repair. However, remember that individual needs vary, and it's crucial to consult with your healthcare provider before making significant dietary changes. These suggestions are not a substitute for professional medical advice. If you found this information valuable, give it a thumbs up, share it with friends, and subscribe for more insights into nurturing your kidneys naturally. Your journey to better kidney health starts with informed choices. Take that step today for a healthier tomorrow.